Hello and welcome to the live broadcast as it relates to an update on COVID-19. I am Fidel Neptune. Today we have with us the Chief Medical Officer, Dr. Sharon Belma George, and also the Assistant Principal Nursing Officer, who's also the Immunization Manager, Tekla Baptiste. And they will be speaking with us on the situation of COVID-19 in St. Lucia and also the COVID-19 vaccine rollout. This update is being streamed live via the National Television Network, NTN, also the Government of St. Lucia's Facebook page and the YouTube channel. Welcome, everyone. First, we will have the Chief Medical Officer, Dr. Sharon Belma George, who will provide us with an update as it relates to COVID-19 in St. Lucia.
Good morning, everyone. Good morning. Thank you, Ms. Neptune. This morning, the Ministry of Health and Wellness will provide an update, that is the data analysis, to clearly indicate to everyone where we are in terms of the COVID-19 pandemic in St. Lucia. To date, we have noted a total of 3,966 confirmed cases in St. Lucia, as you can see from our dashboard. Of which we have a total of 218 active cases. I want to also indicate that 66 of the active cases are at the Bordelais Correctional Facility. And in terms of cases within the community, it's a total of 152. We have a total of 3,748 recoveries. And we also note a total of 47 COVID-related deaths in St. Lucia to date. In terms of some of our indicators, our prevalence rate is 218.9. Our percentage positivity is 11.9%. We've noted a total of 15 of the British variant in St. Lucia. It's the only variant that we have identified on island. We continue to send samples to the Caribbean Public Health Agency, and to date we've noted a total of 15. Our case fatality rate is 1.2%. As we compare cases, and I want to indicate that our lab backlog has been completely cleared, so we are updated with our information. If we are to compare the previous 14 days, that is the period between the 13th of February to the 26th, we saw a total of 840 new cases, as compared to the past 14 days where we saw between the period of 27th of February to the 12th of March, where we saw a total of 208 cases. Our total number of tests done to date is 33,348 thus far. And our daily testing rate is 8.5. If we are to look a little further at the age group analysis, we continue to see that the majority of the cases fall between 25 to 49 years. We still see more female cases as compared to male. 53% of our cases are female, although we note a 2% reduction, as we had seen over the last reporting period where 55% were female. You'll note that the lower age groups represent a smaller number affected as compared. Looking a little closer at the age group analysis, we've been very, we've put in the ages based on the school years to give an idea of the effect we've seen from the daycare age group, the infant age group, and the primary and secondary. And they make up 9% of the overall cases confirmed. I also want to indicate that this age group, what we've seen locally, regionally, and internationally, this is the age group that best tolerates COVID-19, where they range from asymptomatic to very mild symptoms. And so far, the recovery has been very good in regard to this age group, apart from the fact that they're the least age group affected. their prognosis has been extremely good in terms of their management, both in St. Lucia and regionally as well. In terms of our regional analysis, the Castries area remains the area that is most affected, with the most cases and also the highest prevalence. This is followed by Gros-Islet, and then followed by Babonneau and by Ancillary. So this we've noted from our second wave, and this trend, this pattern, we note continues at this point in the outbreak. Our regional analysis, we continue to note the northwestern section of the island, and also on the east coast, we continue to note. We've seen an increase along the west, the southern west area as well of the island. In terms of our epidemiological curve, this is where we are at. And as per our forecasting that we had done during the last presentation, where we indicated between mid to late March, from the rate of decrease that we were seeing, we anticipated getting to a safe place by then. You'll notice that we have 3 bars that are outlined. Before I get to them, I'll just indicate that the curve peaked towards the last week of January, and throughout the month of February, we noted a steady rate of decrease. Our daily infection rate is 8.2 per 100,000. Our testing positivity within the last 7 days is 13%, and within the last 7 days, the previous 7 days, it was 20%. So we continue to see a decrease in our positivity. And our rate of transmission is now at 1.6. There are 3 orange lines, the 3 taller bars. I just want to indicate that those 3 bars represent the cases that we are managing at the Bordelais Correctional Facility, and these are not community cases. So those 3 bars which seem to fall out of the epi curve, I thought needed a level of explanation. These are due to the outbreak at the Bordelais Correctional Facility. You note our small wave in March, which was a very little blimp, we had a second wave in October, which went into November, and our third wave that we've managed between January, February, and it is coming, which is clearing up at this point. We note the rate of decrease in cases, and not just in our testing we see in the decrease. On a weekly basis, we note a reduction in persons at the respiratory clinics. We've been noting through our surveillance a reduction in the number of persons with respiratory signs and symptoms, and we've also been seeing reductions in terms of admissions at the respiratory hospital. So the majority of our indicators are also pointing to the flattening of the curve at this point. And I just want to lay a little caution, because I don't think this reduction in cases should be taken out of context. We are pleased for the reduction in cases, but it does not indicate that we are yet in a safe place. We still have, like I indicated, over 100 active cases, 152 active cases within the community, and we would like to bring this number down further before we will feel comfortable. So it is important that although we are pleased with the rate of decrease to date, it is not an indication for us to let our guard down. We still have to ensure we are very vigilant and we maintain all of the measures. It is not an indication for us to socialize or to relax the measures. We still need to monitor very closely, so we maintain the gains that we have seen thus far. I thought it necessary to give a little bit about the outbreak at the Bordelais Correctional Facility. The red lines represent the cases that we have managed at Bordelais thus far, and we continue to work with them to manage and contain the cases that are there. Also, I indicated that we have noted a total of 15 of the British variant. The first case was diagnosed on the 17th of December, and I just want to indicate that there's a time lag because we do not do gene sequencing here in St. Lucia. We send the samples, and we've given an allocation of 10 per week to the Caribbean Public Health Agency, where there's a delay of about 3 to 4 weeks before we could get those results. The only variant that has been identified in St. Lucia is the British variant, and the total number of positives that we have received is 15. 53% of those cases are male. The average age is about 39, and the case range between 15 years and 63 years of age. I also thought it necessary to give an idea of our COVID-related deaths, and we remain very concerned about the number of COVID-related deaths that we have seen to date. The majority of the cases fall between the age range 60 to 64 years of age, and they range from 21 years to a maximum of 91 years. 81% of those deaths have occurred in the 50-plus age range. What we have noted is that the deaths that we see, the pre-existing conditions that we note, and this is just a summary to give you an idea of where our highest risks in terms of poor outcomes for COVID-19. We have high blood pressure, we have diabetes, we have 21% having both high blood pressure and diabetes, heart disease, chronic obstructive pulmonary disease, obesity, end-stage renal disease, HIV, cerebrovascular accidents, that is persons with strokes, Hodgkin's, lymphoma, and asthmatics as well. So for us locally, those are the pre-existing conditions that we note with our COVID-related deaths. Now, we use the term COVID-related deaths because our policy of testing everyone who passes away, some of those cases were from testing after passing away. Some of those persons did have serious other underlying conditions, although they may not have developed the COVID-19 related pneumonia. But because COVID was positive, we report them for transparency. I just want to make it clear that at no point are we comfortable with the number of deaths. Every death is one too many. So we are not making any excuses for the deaths, but we are indicating that there's a wide range of underlying conditions that make it even more difficult when they contract COVID-19, and hence a lot of our strategies have to be focused on protecting our high-risk groups, both in terms of age and in terms of pre-existing conditions, to ensure that as much as possible our chronic disease population, we can keep them as safe as possible. And that includes their diet and exercise, ensure that they are compliant on medication. And now we are given one of the most effective and efficient public health measures, which is the availability of the vaccine. So it's really unfortunate that we've gotten to have as many as 47, but we note the level of illness that some of our persons came in with to start with. So it's one of the areas that we are focusing very strongly on in terms of the management of persons with pre-existing conditions. in terms of the risk analysis, and given our morbidity profile for diabetes and high blood pressure, I thought it necessary to indicate on the cases that we've seen so far what the risk analysis by those pre-existing conditions are. You'll note for the diabetes it's 36.4, for high blood pressure the risk ratio that is 33.9, and for both diabetes and high blood pressure is 32.1. So as much as possible, our persons in St. Lucia, we know we have a problem with diabetes and high blood pressure. We need to ensure that your diet, the necessary exercise, and that you remain compliant, because this is one of the ways that and a very important way that we keep healthy, we keep our resistance up as we manage COVID-19. Thank you.
Thank you very much, Dr. Belma. And of course, we started the COVID-19 vaccine rollout, and right now we had 14,708 individuals being vaccinated. So we'll now have Nurse Tekla Jabatis to speak on that.
Thank you, Fernell.
Final slide, please.
So St. Lucia would have launched its national COVID-19 vaccination campaign somewhere in mid-February, on the 17th of February to be exact. And at this point, we started off with the national launch where we had various representatives representing our frontline workers and key persons in the health sector receiving the vaccine on that said day. Thereafter, we proceeded with vaccinating persons who were in the front line, and I speak of our healthcare professionals, our doctors, our nurses, persons who work in the clinical settings. We also vaccinated our police officers, our firefighters, our firemen, ambulance drivers. They are every day in the forefront of the fight of COVID. So for about 2 weeks, from the 17th until the end of February, we focused on ensuring that our frontline workers were protected, that they received the vaccine. Once we would have received our batch of vaccines from India, we rolled out we moved on to phase 1B. And in phase 1B, the focus at that time were persons in the elderly population, persons living with comorbid conditions. And I just want to bring back the point that Dr. Belma made just earlier in her presentation. We note the comorbid conditions that most of our deaths, that would have the comorbid conditions that were present. So we had persons living with high blood pressure, diabetes, chronic obstructive pulmonary disease, heart disease. And it is very important for us that persons living with comorbid conditions, that they are protected, because we know that they are at very high risk of developing the very severe form of the disease. And of course, we know that could lead to death. So for the past weeks, 2 weeks or so, we have been focusing on persons in that target population. Of course, we have rolled out into the various communities from the beginning of March, and we've opened up also to persons who would have registered, still focusing on reaching those persons who live with the comorbid conditions and our elderly. I must say that the turnout, at the various vaccination sites has been very, very encouraging. We have had a very good response since we rolled out into the various communities. To date, we have vaccinated 14,708 persons, and this is over a period of just about 2 weeks. Some of our highest reported numbers on a daily basis, you know, are over 2,000 doses. Up until yesterday, over 2,000 doses administered. And this response, I must say, you know, it clearly indicates that St. Lucians, that our citizens, they understand the health benefits of vaccines. Vaccines work. We have seen vaccines work. And as Dr. Belma mentioned, it's one of the most cost-effective public health measures. It is because of vaccination. I'll continue to emphasize that with every opportunity that I get. It is because of a successful vaccination program that we are able to boast of the, you know, elimination of a lot of vaccine-preventable diseases. And as such, now we have the vaccine to help protect us from COVID-19. And, you know, we are really encouraged to see the response from the general public. Of course, the vaccine campaign continues into today and the coming weeks. Next week, as we continue to roll out, we do recognize that in as much as we do have the campaigns at the various community sites and selected wellness centers across the island, there is a segment of the population, especially the elderly, those persons who are homebound, who aren't able to access the services at those sites. And because of this, next week, we will be changing our strategy a little to be able to meet the needs of those persons who really require the vaccines. That in itself, that will help us, you know, allow our nurses, our community health nurses and the various teams to go into the various homes, to continue with the elderly homes, to see those persons who are institutionalized and ensure that they receive their vaccines. Also, as part of the campaign, we saw the need to have this public-private partnership. It is very important that we saw it important to partner with the private sector. As such, we know that the private sector also reaches out to a segment of the population that ordinarily would not visit the wellness centers, would not take the very long lines. They too reach out to a particular set of people in the population. And the private sector has reached out, of course, and we will continue collaborating with them. But we saw the need to have a pilot. So in fact, last week, no, it was actually earlier this week. Yes, we had this pilot with Rodney Bay Medical, and that was a very successful one. It indicated to us that it can happen. We can reach out to other persons through the private sector, and of course such partnerships and collaborations will continue in the coming weeks and months as we continue to offer the COVID-19 vaccine to our population. One other thing is that, of course, once we would have covered most of our persons who are at very high risk, we are at a point where there's a need for us to reach out, to move a little further, and to reach out to other persons who are at medium risk. And as such, we are going to be moving on to phase 2, where we will be reaching out to other persons who on a daily basis, by nature of their job, have very high interaction and are also at risk. And I speak of our hotel workers, I speak about the commercial sector, also persons from working in the hotel industry. And we will be reaching out to them. So we are encouraging those persons, of course, to visit the various community wellness, community vaccination sites. Once they are announced, they can access the vaccine at the sites that are nearest to them. For our logistics and our planning, and for planning purposes, to ensure that we reach out and we allocate resources properly, it is very important for persons who are desirous of receiving the vaccine to pre-register. There have been concerns that, I pre-registered for the vaccine, why am I, why is the same information being collected on the said day of immunization, of vaccination? But the pre-registration, I just want to let our citizens know that the pre-registration is really for our logistics and for our planning purposes. But on the day of vaccination, you would be required to walk with your identification card so we could verify and we could ensure that all information, all the necessary information is entered into our health management information system. And so we continue to encourage persons, of course, to pre-register ahead of them receiving the vaccines. Is there anything else that I missed? Just to give persons an idea, persons who have not visited any of our vaccination sites and intend to do so in the coming weeks, just want to give you an idea of what the process is. So someone gets to a vaccination site. Of course, upon entry to the site, they will be registered. And this is the registration that I spoke of. Hence the reason why it is important to work with your identification, with some sort of identification. Once you are registered, then that will be followed by the administration of the vaccine by one of the members of our team. Once you have received, you have been inoculated, you've received the vaccine, there will be a period of monitoring, a period of observation. That is a critical period, and it is important that we do so, because it is likely that persons may have some sort of adverse events following an immunization, and it is important that we monitor during this critical time to see if there's anything happening suddenly. The health education about the vaccine, its side effects, its how to manage any side effects, that continues on ground. So we have our nurses, our health educators who are there to provide information and any guidance as to how to manage. So this is basically it for the rollout of the vaccine campaign. Is there anything else?
Okay, so before we take a few questions from the media, for some persons, they might have the concern as it relates to pre-registration, because they would go online and they would register, but they're expecting that they would get a call or they're expecting an appointment. Can you speak on that?
Okay, so as I indicated, I did indicate what the purpose of the pre-registration is. Persons will not be called individually to be asked to report to a particular vaccination site. Hence the reason why we would announce the sites, the venues for the various dates, the schedule of these for the vaccination activities, and we encourage persons to attend or to access the vaccine at a site that is nearest to them. So no one will be called.
Okay. And I think it's important to note that the schedule will be shared with the media houses, and also it's posted on the Facebook page of the Ministry of Health and Bureau of Health Education, and also the government of St. Lucia.
Definitely.
Yeah. Okay, so we'll take our first question from the media. We have a question from Janica Simon from the Virgin Islands Consortium. The question is for CMO. How many samples have we sent to CAFA in total for variant sequencing, and how many have returned results showing one or more variants of concern? Please specify which variants is possible.
With the occurrence of the variants, I think by now there are probably 6 or 7 variants noted to date. And I think it was from December that we met with the Caribbean Public Health Agency, and an allocation of 10 samples per week was made to countries, as gene sequencing is not one of the capacities that the regional labs have. So they've made an allocation for countries to send up to 10 samples to them, and they actually outsource it. So they don't actually do it themselves, it's actually outsourced. So it takes about 3 to 4 weeks for us to get the results. The total number of samples we've sent, I would have to get an update on that, but I know we send samples regularly for our surveillance purpose. To date, we've received 2 batches of results. It was the first 5 that we had reported, and then we received another batch of 10. So we've noted a total of 15 cases of the British variant, and it's only the British variant that we've isolated thus far. And the labs at CAFA do outsource, they do test for the others. So we've noted the British variant and a total of 15 to date, and we continue to send samples to CAFA for testing, for surveillance, to pick up if we have any here. There's also a requirement that it must be greater than a certain CT value to qualify to be sent. So the sample also has to meet that requirement before it's sent.
Thank you for the clarification. And the question as it relates to the COVID-19 vaccine, for many persons, they might be asking the question, can pregnant women or mothers who are breastfeeding, can they get the vaccine?
Yes, they can. The COVID-19 vaccine is a non-replicating vaccine. So one, it does not transfer onto the fetus, and also it does not pass through breast milk. So for the lactating mother, of course, if someone is desirous, is lactating, is breastfeeding, and is desirous of having the vaccine, it is absolutely, it is safe. She can have the vaccine, especially if, you know, she belongs to a very high-risk group. She has comorbid conditions that put her at very high risk. She's in a particular, maybe her job. She's a frontliner, somebody who is at very high risk. For us, the benefits continue to outweigh the risk, and in the studies and through the trials, we have noted that, of course, as I said, the vaccine does not transfer through breast milk, so it is absolutely safe. It does not cause any harm to the baby. For the pregnant woman also, benefits continue to outweigh the risk. Of course, we know there's still very little studies that have been done in that target with pregnant women. We know that the vaccine is non-replicating, cannot transfer onto the fetus or cause any harm, rather, to the fetus. But again, if this pregnant woman is of very high risk of developing, you know, she developing the severe form of the virus, if she becomes infected, she would be counseled, of course, and with the advice of her physician or healthcare provider, it is absolutely safe for her to have the vaccine.
Thank you. And we have a question from Nersha Shalmang from Choice TV. The question is for the Chief Medical Officer. Can you discuss the issues with the AstraZeneca vaccines in the European countries, and also concerns with the blood clots?
Okay. We have been receiving quite a few messages on concerns. I don't know if Lucia Baptiste wants to address this question, or she wants me to.
You could start, I could pop in.
Okay.
Either way, it doesn't matter.
And I think not just on this issue, but this is one of the things that we really need to clear up and to guide the public, as there have been a lot of misinformation, there's been a lot of fake news articles on the use of the vaccine. So based on a statement which was sent to us through the WHO, through the analysis of the situation, I will refer to some of the points that they had pointed out. As a precautionary measure, a few of the countries within the European Union have suspended a specific batch of the AstraZeneca vaccine that was distributed in the EU. And these were based on reports of a very rare blood coagulation disorder in persons who had received the vaccine from that batch. So it was decided as a precaution while the full investigation is being finalized. Now, it is also important to know that the European Medicines Agency, the pharmacovigilance risk assessment community, the position is that the vaccine's benefits continue to outweigh its risks, and the vaccine can continue to be administered while investigation of those cases continues. Now, the Global Advisory Committee on Vaccine Safety, they systematically review any vaccine safety signal and concerns that's related to the COVID-19 vaccine safety, and they meet regularly to advise on any safety signals or concerns that are related to the COVID-19 vaccines. They're also assessing the current reports on the vaccine. So as soon as there's a full understanding, this will also be communicated to the public. But I want to also indicate, because we have seen so many fake reports about persons who got a vaccine and die without doing the necessary investigation of what were the underlying or comorbid conditions of those persons. So they've also indicated that the vaccine will not reduce deaths from other causes. You have persons who were very ill from other conditions, and we also see it with our COVID-19 related deaths, where I want to make it very clear, the Ministry of Health, we don't make excuses or accept. Every single death is important. This is a family member of someone, this is a loved one, and it should not be seen just as a statistic. Mm-hmm. We have been focusing on reducing complications and deaths due to COVID-19. However, the vast majority of the persons we've seen, a lot of them had other conditions who their prognosis was very poor, and the COVID-19 situation doesn't make it any worse. But the vaccine, if you were already very sick and you took the vaccine, it will not prevent you from dying of other causes. Okay, so deaths after the vaccine would not be related to them taking the vaccine. And a lot of the articles, when you do find out from the countries, those were persons with other serious underlying conditions and not related to them taking the vaccine. As of March 9th, over 268 million doses of COVID-19 vaccines have been administered since the start of the pandemic, based on the data reported by national governments, and there have been no cases of death that have been caused by the COVID-19 vaccines to date. So countries do the investigation when there is a death after someone takes the vaccine and it has not been shown to be due to the COVID-19 vaccines. Our committee at the Ministry of Health as well, we are monitoring the side effects, and I think it's important for persons to know, usually 24 to 48 hours, most persons reported feeling a level of fatigue. Some persons had chills, some persons had mild fever, some persons reported joint pain. Remember, your body is producing an immune response to the vaccine. So it is normal that you would feel that way. I think there's a lot that we need to clear up because we read a lot of fake information out there. The companies that make the vaccines are the same companies that make the vaccines that we received as a child. So just as when we take our kids to get vaccinated, sometimes they develop a fever, there's a bit of pain at the site where they got the vaccine. There may be irritability. There may be joint pain. It's quite similar because your body is building an immune response to the vaccine. And this vaccine is not out of the world. The base of this vaccine is similar to all of the other vaccines that is being used. We know what is in the vaccine, okay? The few differences that we have is the protein of the virus, to put it very simple, that is added to the vaccine to allow your body to produce an immune response. So there is no live virus in the vaccine. So you will not develop COVID from getting the vaccine. There is no live virus within the vaccine. Also, there is no DNA within the vaccine. So it will not, and even if there is DNA, injecting DNA cannot alter your DNA. This is not possible. But the vaccine does not have DNA, and it cannot alter your DNA. There is no chip in the vaccine. We want for us to continue to be guided by the science and see how in the countries that have utilized the vaccine as a public health measure, how they've noted the reduction, and there is a lot that we know about the vaccine. The reduction in severe cases, 100%. Hospitalizations, 100%. Deaths, 100%. This alone is enough for us to feel satisfied. And the vaccine is safe. It has been tested. So there is enough known about the vaccine for us to feel comfortable taking it and providing it. And we are very happy with the response from St. Lucia. I have to really recognize the teams who have been working very, very long days and nights to get it here. Our nursing team, Events St. Lucia has been amazing working with us. The Cadet Corps, all of the rest of the police, the social transformation. I hate calling out groups because I always forget somebody. The social transformation officers, the volunteers, who am I leaving out? I'm leaving out some important groups, I'm sure.
Physicians and nurses from both primary and secondary care.
Yes, our physicians and nurses, our volunteer physicians who have been assisting us, especially on the ground in the community. And the public turnout is very, very encouraging that we are on the right track to keeping our numbers down and remaining safe so that we can get to some level of normalcy. For persons who choose not to take it, we know it's a personal choice and we respect that. But I think that the ministry, we need an opportunity to share updated, accurate information with you so that you can have the correct information to be able to make an informed choice both for you and your family. And we are prepared to do that because whenever I think I see persons saying false information, I see it as a gap in our strategy, that this is a group that we have not met to inform. So we will continue in terms of strengthening that aspect of it.
Thank you very much, Dr. Belma, for giving us that reassurance as it relates to the safety of the vaccine. And of course, you mentioned that the benefits outweigh the risks when it comes to the vaccine. Okay, so before we go into our next question, we have another question from Janica Simon also, and the question is, what treatments are being provided to people in care, especially critical patients? Are we using monoclonal antibodies or any other therapeutics?
One of the things which we are pleased to, we note the reduction in the numbers at the respiratory hospital. For today's numbers, we have a total of 48 persons admitted, 43 positive, and 5 are suspect cases, with a total of 3 persons in critical care. The therapeutics, that is the treatment that we give at the respiratory hospital, it varies and it is based on your comorbid conditions and also the condition that you come in with. And your condition could be from mild, moderate to severe, that is if you are critical within the ICU setting. So we have patients who are ventilated in the most critical patients. We also have patients who may be moderate and severe, requiring high flow oxygen. We're also using steroidal treatment. We use supportive treatment, such as we give zinc, we give vitamin C as well. And like I said, the high flow oxygen, many of the patients come in some level of respiratory distress. And like they have presented before, their need for continuous oxygen has increased with the wave that we were managing, since they did have an increase in patients who were admitted there. And then based on what other underlying conditions, if they're hypertensive, if they're diabetic, if they're recovering from a stroke, based on what they come in with, their treatment would be related to their comorbid conditions. There are some patients that we also have to put on antibiotics. And I know the team there, they're really doing their best. We also have been getting a lot of support from the clinical team from Martinique. Over the past month, the consultants have been at the respiratory hospital 2 at a time, and we are extremely grateful for that support. They brought in quite a bit of medication and equipment because they did an assessment of the respiratory hospital. So what they did, they were there 2 at a time. They carried out training for the staff, and they also have been managing the patients there over the past month. So we are extremely grateful for that support and building the capacity to continue managing the cases there.
Great. And since we're speaking about patients at the respiratory hospital, the question that I would like to ask is that for persons, they might say they want to get the COVID-19 vaccine, but they just recovered from COVID-19. How long after would they have to wait before they can get that vaccine?
Okay, what the recommendation is, if you've recently had COVID-19, they're saying because your body produces natural antibodies after having the virus. So what is usually recommended, and that is because most countries, they don't have enough vaccine for the entire population. The recommendation is that you wait a period of 90 days, since your antibody level against it would still be high, so you'd be protected from getting it a second time if that's possible. So what the recommendation is that you wait a period of 90 days before. But that being said, some countries have chosen to vaccinate everyone, whether or not you had recovered or not, and there isn't any side effects from getting the vaccine if you had recently recovered. It's just about making the most efficient and effective use and giving the vaccine to those who need it the most, who would not. So we get questions as to, do you need to test before you take the vaccine? You don't need to test before you take the vaccine, because even if you were a positive case that we had not picked up, taking the vaccine is not going to affect you in any way as well. So that's the recommendation that's coming from us.
Thank you. And we have 2 more questions from the media. The first one is from Riani Isidore from NBC TV. The question is, based on the current vaccine stock, which is 3,000 from Barbados and Dominica and 25,000 from India, minus the 5,000 designated for Grenada, it would appear that St. Lucia has enough to fully inculate 11,500 people, yet the Ministry of Health immunization count exceeds 14,000. Is the Ministry of Health rolling out the entire stock via single-dose stocks? And if yes, does that practice conform with WHO PAHO vaccination guidelines?
Okay, I'll take that question. Okay. So we know that the COVID-19 vaccine, it's a 2-dose vaccine, so it's given in 2 intervals. The initial guidance does indicate that the vaccine could be given some 4 to 12 weeks. Subsequent to that, an updated guidance was sent a couple of weeks later, where it indicates that there have been higher efficacy noted with the longer intervals. And as such, they are recommending that the intervals be between 8 to 12 weeks. Yes, our first supply of vaccines was what, 23,000? Yeah, 23,000, so that would be just about 11,500 people. We have decided that we will continue with our first dosing because we are expecting our next batch, which is the first tranche from our COVAX allocation in the next couple of weeks. We're looking at the end of March into the early weeks of April. Again, based on the guidance, the vaccine committee, we can decide to extend the interval for persons who would have had the initial set of people who would have received the vaccines, because initially we started off with an interval of 6 weeks. But since the new guidance, we have since opened up our interval to 8 weeks, to every 8 weeks. So yes, we will continue administering first dose with our 23,000 doses of vaccine. So as soon as we receive our first tranche from COVAX, which would really be our second batch of vaccines into St. Lucia, then we will start off with our second doses. And soon after, we expect to get another tranche of our allocation. So we will have enough vaccines, at least to continue and do our second dosing and to continue with our first dose.
Wonderful. And our next question is from Glenn Simon from Ministry of Finance. Will teachers and principals, including early childhood practitioners, be prioritized in preparation for possible third-term return of in-person classes?
Yeah, actually, I just forgot to mention that was one of the key groups.
Please don't forget the teachers; they're extremely important.
I know, and you know, we want the teachers back in school, we want our kids back in school. So yes, I did mention in my update that we would have been opening into phase 2, and then we would be involved in other sectors such as transportation and hotel workers, and yes, education. So the teachers and the early childhood educators will be included.
Thank you. And our final question from the online platform, will there be a vaccine for children?
Well, at this point, there are still trials being done in this younger age group, and as we speak, we don't have a vaccine that is recommended for children of that age group. So until any further guidance is given based on results of ongoing trials and research, then no, we have to wait for this guidance from the experts.
Yes, they are actually now doing trials on the below 18.
Okay.
So it's not that it's not safe for them, but it has not been cleared for their use as well. So as soon as we get that go-ahead, we would include them in our...
Wonderful. Okay, so before we wrap up, there's a question that I think a lot of persons have concern with. It's as it relates to quarantine for persons, because a lot of persons are asking this question now. Given that I've gotten the COVID-19 vaccine, does it mean that with me coming to St. Lucia that I don't have to do the 14-day quarantine period?
Yeah, this is a very common question that we are getting on a daily basis. What are the new protocols, given that many countries are rolling out vaccines? Based on what we know and the research from the rollout of vaccines in various countries, we are aware that it prevents between 63 and 74 persons from getting COVID. There's a very small group of persons who may get it and get very, very mild or asymptomatic. So we know it prevents completely the severe form of the disease, it prevents hospitalizations, and it prevents death. But what is not completely known is for someone who has been immunized, what is their capacity of transmitting this virus to others? So we know when you take the vaccine, you are protected. But what is the capacity of you spreading it to others? And this is what we are monitoring the research to assist us in changing some of our protocols. So For example, someone coming from a country, the US, the UK, they have been fully immunized, so they're safe. But because in St. Lucia, we are only now rolling out our campaign, the majority of our population is still not covered. So for us to be able to feel safe in changing our quarantine and isolation guidelines, we would first need to get at least our 70% coverage in country. And we would need to have enough data to know that the transmission is also greatly reduced by persons who have the vaccine. So this is some of the information that we need to see how we make adjustments to our quarantine. So for now, even if you have been fully vaccinated and you're traveling, coming into St. Lucia, you would still need to do the quarantine. And we also saw quite a few articles where they're saying, if you have been fully immunized and you come into contact with a positive case, there may not be a need for you to now quarantine. So these are some of the measures that we are looking at. And I know that especially with companies, the level of inefficiencies based on persons who have to be quarantined and isolated that is causing, this will definitely be one of the benefits that is seen for them to ensure that as many people as possible are covered.
Okay, so then that also leads to the part where persons might ask, with the public health measures, because we've gotten vaccinated, does it mean that we have to relax on those measures, or we still have to follow those measures?
At this point, first of all, most of our people only got the first dose, so we're not at the high level of efficiency yet. Until we know for sure and we have received, and enough of our population is covered, we would need to continue following the public health measures of wearing your mask, physical distancing, and the infection control measures of washing your hands regularly, use of hand sanitizer. So for now, we maintain those measures to keep us safe.
Thank you very much. Well, we have come to the end of the updates as it relates to COVID-19 and the COVID-19 vaccine. Of course, we want to thank the Chief Medical Officer, Dr. Sharon Belmar-George, and also the Immunization Manager, Nurse Tekla Jabatis, for being here and providing us with this information. Well, with that, we've come to the end. Thank you so much for tuning in. Until next time, thanks on behalf of the entire production team at GIS NTN. Thanks so much.